Hello students, welcome to this session. So today we are going to discuss about bone marrow examination. Structure of bone marrow. Red marrow present between bony trabecula which contains cells of myeloid, lymphoid, erythroid and thrombopoietic series and reticulum fibers, blood vessels and fat cells. The examination of cellular composition of bone marrow is essential for diagnostic purpose in wide variety of disorders of the hemopoietic system. The types of bone marrow are bone marrow aspiration and Triffin biopsy. Bone marrow aspiration, it is aspiration of particles of bone marrow with help of aspiration needles. The needles should be strong, wide bore and it should be with the guard to prevent over penetration. The examples of bone marrow aspiration needles are Klima, Salah, Jamshidi. The sites of bone aspiration collection is in adults, body of the sternum or iliac crest. In children, if it is less than 1 year, then it is medial aspect of the tibia, and for more than 1 year child, it is iliac crest. Now we will see procedure of bone marrow aspiration. So in that, first local anesthesia is given into the periosteum, or sedation or general anesthesia is given in children. Then clean the parts, like if you are taking for adults the body of the sternum, or for the child medial aspect of the tibia or iliac crest, then clean the parts with aseptic precaution with spirit and betadine. Then bone marrow aspiration needle is introduced into the bony cavity by to and fro movement. After cavity is penetrated, stylet is withdrawn and tightly fitting syringe is attached. Then brief and strong suction, you can take 2 ml of bone marrow tissue. Then films are prepared immediately by placing the aspirated material on glass side and sucking of the blood which is contaminated. Then air dry and then films are fixed into the spirit or methyl alcohol, and then you can do staining of the smears by Leishman or Wright stain. So by Leishman or Wright stain, you have to add the stain for 5 minutes, then add buffer for 5 minutes and then wash with water and dry it and see under high power and then oil immersion lens. Now after the smears are stained, then we can do examination of the bone marrow. So in that we have to see certain points like cellularity, so either normal or hypercellular or hypocellular. So that we can make out by the cavities which are present because of the fat cells. So if the normal cavities are seen, then it is normal. If the cells are more and cavities are less, then it is hypercellular. If the cells are low and cavities are more, then it is hypocellular. Then we can study erythropoietic series, leukopoietic series, then plasma cells which are seen in increased quantity in multiple myeloma, megakaryocytes, if they are increased, then they are seen in thrombocytopenia, parasites like blood parasites like plasmodium species or the leishmania species we can see, and then we can do special staining of the bone marrow examination for identification of iron. We can do it by Prussian blue, or for the acute leukemia we can do special staining like periodic acid shift, peroxidase or Sudan black staining. In this picture we can see all the myelopoietic series like myeloblast, myelocyte, metamyelocytes, band forms, or erythropoietic series like erythroblast, normoblast, reticulocytes, and thrombopoietic series like megakaryoblast, megakaryocyte, and the platelets. So in this picture you can see examination of bone marrow. So all the series of cells of the myelopoiesis, erythropoiesis, thrombopoiesis, and the blood parasites like microfilaria, plasmodium species, or leishmania. These are my references from where I have taken my notes, and I hope you find this session very useful for your academics and for your future practice. Thank you so much.